and today I'm going to talk to you about the correlation between drug use and homelessness, specifically in the Omaha metro area. Unfortunately, there's not significant statistics on drug use in the homeless population in the Omaha metro area, so the study looks at the drug use in the homeless population in the United States as a whole, as well as the drug use and homeless separately in the Omaha metro area. The new approach on the sheltering homeless and decreasing drug use is essential in the Omaha metro area. It's costing Omaha a significant amount of money and resources, as well as offering no long-term solutions in this area. First scope. According to the National Institute on Drug Abuse 2020, from 2017 to 2019, there's been a small decrease in drug-involved deaths with a total of 7.2 deaths per 100,000 people. This ranks Nebraska number 1 in America with the lowest death rates related to drugs in the United States. This low drug-induced death rate is representative of the amount of drugs in Nebraska compared to other states. However, with that being said, there is still a significant problem that needs to be fixed. According to Landscape Omaha 2017, the percentage of homeless population is decreasing until 2015, when it slowly started to increase by nearly 1,000 people per year in the Omaha area alone. The numbers given by Landscape Omaha are approximate numbers of those needing assistance or at a shelter. It's estimated that a large amount of people are not accounted for because they stay with friends, family, or move from place to place each day. This estimated count shows Omaha Metro's homeless percentage and drug abuse percentage is significantly lower than other cities of similar size in the Midwest and in the United States, but still a major problem that needs a solution in our area. History. Homelessness goes back as far as historians can know, with New Age changes for reasoning and resources offered. Drugs have also changed in the recent years. Humans have always taken mind-altering drugs. However, since science has brought us multiple new drugs. Cannabis, opium, cocaine, and blue lotus have always been found around for thousands of years and found in nature. But in the last 200 years, new drugs have been synthetically made and sold for even cheaper. LSD, amphetamine, crack, cocaine, and opiates are newer and stronger and cheaper than natural found drugs. This leads to increased drug use and addiction rates. There is no certain sequence of events that happens for someone to become homeless or addicted. There are a plethora of factors that increase someone's risk for being homeless and substance abuse. One of these is the age that someone becomes homeless first, as well as the length of someone who remains homeless. Oftentimes, someone becomes homeless, drugs are turned to try and cope with the situation. Other times, drug addiction plays a large part in becoming homeless. Someone with a substance abuse problem often grows apart from their family and friends, losing their support system. The addiction can also cause the person to lose their job and their income, making them fall even more behind on bills and lose their house. Landscape 2020 shows more than half of the renters in Omaha metro area spend more than their recommended 30% of their total income just on rent. This high housing cost and low minimum wage make it hard for a person or family to afford housing while still trying to pay their bills and afford the necessities. Demographics. According to American Health Ranking, there's multiple factors that contribute to drug use and homelessness, including living in an urban city instead of in the rural area, being male, having lower education, being unemployed, and being in between ages 25 and 54. UNMC did a study in 2016 where they looked at all of Nebraska and the metro area. They found 11% of Nebraskans have no health insurance, 3.1% of Nebraskans are unemployed, almost 13% live below the poverty level in Nebraska, and 17% of young adults ages 18 to 25 use drugs regularly in the last month, as well as 40% of teens between 18 to 25 binge drink multiple times in the last month. This just shows the young age that people are starting to use and depend on drugs and alcohol to cope. This later makes them more prone to becoming homeless and having addiction problems. There's a plethora of resources in the Omaha metro area. There's 8 homeless shelters, 2 homeless intervention teams that go into the community and give supplies and resources to those in need, multiple programs to help with personal supplies, clothes, food, medical, dental problems, transportation, and legal help. There's 10 rental and financial assistance companies and 6 utility assistance programs dedicated to keeping people from becoming homeless. There's 3 inpatient detox centers in the area, as well as 7 outpatient chemical dependency programs. For those that are homeless or in need, there's also free or reduced transport in the Omaha metro area. However, we still need to figure out something else to help with the homeless and addiction problem that Omaha metro area faces. One of these is a low barrier shelter, such as cottages or tiny houses. So a low barrier shelter is somewhere that doesn't have multiple strings attached for you to get admitted there or to stay there. For example, in Omaha, at the Open Door Mission, you have to take a drug screen every single time that you walk in. If you don't pass the drug screen for any reason at all, then you are no longer admitted to stay there. This suddenly closes down a lot of different options when one person makes a bad mistake once or twice. So at these low barrier shelters, such as cottages or single shelter rooms, they're used in multiple states and throughout the world, but not Nebraska. This is something that Omaha has not tried yet, but could potentially be beneficial to the homeless population in making them feel as if they have a place to call their own, something to work towards and keep clean, and it decreases community spending on the shelters. For example, in Southern Oregon, there's a low barrier shelter where everyone has their own small cottage with a community dining room and kitchen. However, with this type of shelter, there's a varying price range, and it can be a challenge finding locations that are affordable and can accommodate the large amount of people in the shelter. This can mean finding a location to build a low barrier shelter can be costly and take time to find. There's also significant pushback from the city residents, worrying that a better shelter accommodations and having their own area would quote unquote increase the amount of drifters that come to town. Another low barrier shelter in California bought used motels for sale as a shelter. This cost about $8 million to buy the land that was ready to go. The property was set up and ready for move-in right away. The other county in Oregon had the homeless build their own tiny homes. A tiny home costs between $15,000 and $20,000 to build, which is significantly less than the alternatives. The cost is decreased even more by having the participants in the program help build the same, decreasing the amount of work that needs to be hired out. The funds given to the traditional shelters in Omaha could be partially rerouted to look at getting funds to help the homeless population for building cottages or tiny homes. For argument's sake, let's look at Omaha. So there are 1,400 homeless people in the Omaha metro area right now. Assuming that each tiny house costs $18,000 to build, which mind you is above average for a generic tiny house in this area, the cost to build a tiny home for every single homeless person would be $25 million. This number would be even less considering the amount of people that are married, live together, or are families. Now this may seem like a big number, but when you look at the amount of people that live in the Omaha metro area, this would only cost Omaha residents, also known as quote-unquote the stakeholders, a one-time payment of less than $50 per person to shelter every single homeless person and give them somewhere to call their own. To put this into perspective again, last year the Santa Francis House built a new area where they can house 450 people per night. This 450-person traditional shelter cost over $23 million for them to build. Another option that we need to look at is increasing long-term mental health wards and increasing mental health opportunities in the area. Mental health problems are another major factor in the homeless population and account for a large part of the drug abuse problem in the metro area. When a person has a mental health problem, they're likely to try and self-medicate with drugs and often have a hard time trying to keep a job while trying to cope or deal with their mental health problems. Long-term mental health care facilities and short-term mental health care facilities have continued to be closed down, making a severe shortage of mental health beds for those that need it to the community, shifting mental health care to the correctional facilities. More or less meaning that instead of noticing that people have mental health problems, they now just go to jail because it's easier. One person said, even where those beds are gradually unable to treat someone for more than 72 hours at most, This means that you send the ill back on the streets without actual adequate treatment. There needs to be more availability in inpatient psych care as well as a continuum of care throughout the discharge, outpatient, and long-term psych facilities. In Nebraska, there's only one facility that's government-ran general psychiatric hospital, and it's located in Lincoln. It holds less than 100 general psych patients, and it's generally always full and has a waiting list that lasts up to weeks. This one facility is nearly impossible for a general patient to get into, and many are unable to travel all the way to Lincoln even if they are able to get into it. The only other option in the Omaha metro area is privately ran for-profit mental health hospitals. Even in private ran hospitals, the care is based around profits and how much the hospital is reimbursed. For example, in Medicaid, there is a cutoff point where the government will no longer reimburse the hospital for care given, and then the hospital will start to lose money. This is usually the point that the patient is discharged, even though their treatment may not be finished, and they may be in the exact same mental state that they were when they came in seeking help in this emergency situation. This continuation of being quote-unquote treated for a day or two and then being put back in the same environment is not beneficial, is making significant strides, is taking away from strides to help the mental health community, substance abuse community, and the homeless community. There needs to be more funding and resources for the Omaha residents and long-term facilities in the area. This increase of funding needs to increase the amount of time someone can be in a mental health facility, including not having to worry about being discharged early or not being able to pay the bills. Increasing the amount of government-ran facilities and increase post-hospitalization care. The upside of increased hospitalization time and post-hospitalization care would be the amount of readmissions mental health sees would be decreased, and the patients would have increased self-worth, self-care, and ability to get back on their feet. They'd be able to make sure they were on the right drug regimen that works for them and decrease need to self-treat with drugs, increasing the ability to live a normal life and be part of society again. The major downside would be the cost and the patients not having to worry about, and the worry of patients being gone from society for long periods of time, including those that may have jobs or families. In 2016, the Nebraska Medical Center looked at the behavioral health in Nebraska. They found 62% mental health care and 69% of substance abuse disorders and treatments in Nebraska was paid for by the public. If we were to look at the amount paid for bounce backs or patients returning needing more care, the extra days of initial hospitalization would cost less in the long term. This also needs to be funded through the public and the government pre-hospitalization, such as cares for mentally ill, recovery, affordable, and free counselors that patients would be able to get in and see when they need, as well as an actual crisis response team that's always available and ready to go. These are our references. Thank you.